Hello, everyone. I'm with a wonderful patient of mine. Her name is Ellen. We've known each other for a few years, and she comes to us because she's passionate about relationships. She's passionate about being with her partner, both emotionally and intimately. And she came to me because she wanted to improve this and improve her quality of life. And instead of me saying what's going on, Ellen, would you mind just sharing with everybody?
I'll be
just
very happy to do so. I think it was quite a while ago because, I was with Dr. Goodman before you took over the practice. And I saw in the office something about Femilift.
Mm-hmm.
And it mentioned in the Femilift that it could also help with urinary incontinence.
Yes.
And at my age, that's not uncommon.
Mm-hmm. Yep,
And
yep.
also,
Thank you for saying that.
yeah, and also, I always felt like I had a yeast infection, that kind of itchy
Yes.
stuff. And I just didn't know what was going on. So I consulted with Dr. Goodman at that time because you were not there yet.
Mm-hmm.
And I had the treatment done. And I think it's one of the best choices I ever made.
Mm-hmm.
Best choice in my life was quitting smoking.
You're right.
Second choice is getting the Femilift. And it's enabled me as an older female to not have that constant feeling of dryness.
Yes.
Also, in intercourse, you're not uncomfortable at all. I mean, you just don't have these problems that you had before. And this treatment itself is very simple. I mean, it takes maybe 15 minutes. I've never counted the minutes. And then you have, and you get it again in a month and usually again in another month. And after that, you just feel like a young person again.
Yeah.
You don't have all these things. You don't have to accept, oh, well, I'm getting older, so this is what happens. You need to be proactive and ask for help. It's not that expensive, and it really makes you feel like, continuing intimacy, continuing a productive life, not thinking you've got a yeast infection every day. And it has helped me considerably with urge incontinence. Because when I used to get home, the minute I touched the front door, I was in bad trouble. And now I don't have to worry about that. And it lasts for me about a year. And when I start getting symptoms again, I know it's time to come back. And I've had it done, I think it's for almost 4 years now. I get it done every year. And it's certainly, people often ask me, I'm 82. And people say, well, how come you don't look like 82 or act like 82? And a lot of that has to do with taking care of things. And I think taking care of your vagina is something that you need to do rather than just giving up and say, this is the way it is. I accept it. I'm just going to suffer. I don't believe in just suffering.
This is 82 years of wisdom. If you value love, relationship, intimacy, empowerment, and not having to wear a panty liner, not having to rush to the restroom, find the Femilift. I'm not saying it. Ellen is. Ellen, thank you so much.
Well, thank you for
People are going to appreciate what you're giving them today.
But thank you for, when Goodman decided to retire, we were all scared because we thought, we've had this wonderful thing of cosmetic, gynecology. Wow. And we were all afraid it would end.
Yeah.
And then you came.
Here I am.
You came, and I tell you, we were so happy because I thought, I don't know where I'm going to go because this is not, it's not a huge thing but it's growing. And I'm happy to say that it works and help other people decide to do something for themselves and, stay young.
Couldn't have said it better. Thanks again, Ellen.
Oh, yeah, thank you.
Thanks.
Thank you.